us now Dr. Alfredo Galassi, Professor of Cardiology from Italy. Hello, Doctor, and welcome. Okay, what are you going to present this year?
This year we are presenting the data from the EuroCTO Club, from which I am president, and I'm really honored to say that in this field of action Europe is really one of the leader amount of countries around the world that are really deeply involved in these complex interventions, and we have been publishing many papers on this topic, and also actually CTO is now really on fashion. This year at PCR and even here is really CTO revascularization is a really big topics of on fashion, and a lot of good presentations are of course showing that now Europe is well prepared to have successful procedures, and also these procedures now are not only successful but with very limited complications, and this of course is something that is helping us to understand more and more and making a lot of benefit for the patients for achieving complete revascularization in very complex interventions.
What's new in the field of coronary intervention this year?
Well, actually in the field of coronary interventions CTO and also possibility to treat all bifurcation left main are now well established, and it's really really a great pleasure to understand that now PCI really can do a lot of similar to bypass, and this is also thanks to drug-eluting stents, thanks to the new techniques and technology that are able to be in a way they're giving the possibility to the interventionalist to perform full revascularization to these patients, and of course this is the main object of the PCI as compared to bypass surgery, where in some instances probably complete revascularization was not possible to be attained.
Okay, what's your opinion regarding the new bioabsorbable stents?
Well, the new bioabsorbable stents is a new field of action, and of course there are a lot of issues that can be they should be focused when we are looking at bioabsorbable stents. Of course, it's a new technology. There are a lot of issues that are related to the fact that it's being a new technology. There are pros and cons. But we also need to remember that if we use this new technology, keeping in mind that there is of course a lot of things to be well followed, like for example we call the 5P, which are for the bioabsorbable stents, of course the proper sizing, the prepare the lesion, to pay attention to the expansion, and also post-dilatation, and then platelet therapy in the follow-up. We know that these reabsorbable stents, of course, are a new field of action that may have some hint in the future. Of course, we have to remember that they can leave the artery able to respond to the tone, and this of course is making a very good advantages as compared to the metallic stents. Of course, we also need to say that very often we use these scaffoldings for patients who have with very many comorbidities, and this of course makes the disappearance of this scaffolding a possible problem for the issue that in this patient new atherosclerosis develops. So we don't know really what is the future in these patients, what can be the future in these very high complex patients. And of course we should still, I think, compare this data with the metallic drug-eluting stents in order to assess what are the best patients that should be treated with this technology.